Ann, and I am a lactation consultant here at Memorial Hermann Northeast Hospital. And today I will be teaching on mastitis, and I'll be teaching women's services nurses this lesson that I've gotten together on mastitis so that they can help their lactating moms prevent this. So we'll be teaching about 10 groups of 5 or so nurses. They'll be attending this learning session. They'll be taught by a lactation consultant using the Mama Breast Simulator. Nurses are involved in the discussion. Quizzes are taken amongst the group. To generate a discussion in the introduction part of the lesson, some questions that may be asked will be, how many of you are familiar with breast massage and hand expression used to prevent mastitis? How many of you are familiar with the 10 steps to successful breastfeeding, and can you tell me about step 3? There'll be a pre-assessment quiz, discussion of information about Memorial Hermann Northeast Gold Toward Baby Friendly designation and the importance of the 10 steps to successful breastfeeding. There will be handouts and flyers. A discussion of information on flyers will be benefits and importance of hand expression. There'll be a 4-minute video watch called The Basics of Breast Massage and Hand Expression, and then demonstration of breast massage and hand expression technique using the Mama Breast Simulator will be done. There'll be a post-assessment quiz, and then there'll be questions and answers at the end. So some learning objectives are, number 1, women's services nurses will state common subjective and objective findings associated with mastitis. Number 2, discuss the etiology, incidence, and risks associated with mastitis. Number 3, discuss the role of therapeutic breast massage and hand expression in the treatment of mastitis. And number 4, develop a plan of evidence-based management for mastitis. So we have a case study of a mom that comes in. She's a 34-year-old female, 5 weeks postpartum. She presents to the ER with severe pain in her left breast, fever, and chills. She states she has been exclusively breastfeeding her 5-week-old infant and started running a fever and felt like she had the flu a couple days ago. She has redness over the nipple with a scab on the tip, and she states she has been suffering with engorgement since her milk came in at day 3 postpartum. And it took a while for her infant to latch correctly. There is redness on the lateral breast, and the breast feels hot to touch. Okay? So patient history, she had a vaginal birth at 38 weeks gestation. This is the patient's first baby. She's been taking ibuprofen 600 milligrams every 6 hours for pain, and she feels like it helps. She doesn't have any known drug allergies. There is nothing of importance in her past medical nor surgical history. Her grandmother has been deceased for 10 years from breast cancer, and nothing else noted in her family history. Laboratory investigations and other diagnostic procedures are not routinely needed nor performed for mastitis, and the World Health Organization publication on mastitis suggests that breast milk culture and sensitivity should be undertaken if there is no response to antibiotics within 2 days. The mastitis recurs. It is a hospital-acquired mastitis. The patient is allergic to usual therapeutic antibodies in severe or unusual cases. And that comes from the Academy of Breastfeeding Medicine. So some normal and abnormal pathology associated with mastitis. Worldwide, the most common pathogen in infective mastitis is penicillin-resistant Staphylococcus aureus. Less commonly, the organism is a Streptococcus or Escherichia coli. And the picture on the left is a diagram of a normal lactating breast here. And then this picture is a picture of mastitis within the milk ducts that you can see there. And it's been, the picture on the right here is inflamed, and you can actually see that, the inflammation there in the picture. So, the usual clinical definition of mastitis is a tender, hot, swollen, wedge-shaped area of breast associated with a temperature of 101.3 or greater, chills, flu-like aching, and systematic illness. However, mastitis literally means it is defined as inflammation of the breast that may or may not involve a bacterial infection. Some predisposing factors are damaged nipple, especially if colonized with Staphylococcus aureus, infrequent feedings or scheduled frequency or duration of feedings. So it's a mom that schedules the feedings instead of just feeding her baby on demand. She misses some feedings. That could also be a risk factor. Poor attachment or weak or uncoordinated suckling, which leads to the baby not getting the milk out, and so that could lead to it. Illness in mom and baby, rapid weaning, pressure on the breast. So any tight bras or underwires or anything like that that comes and applies the pressure on the milk ducts is going to cause or can lead to mastitis. White spot on the nipple or a blocked pore or duct. Maternal stress and fatigue is another predisposing factor here. So treatment options and management for mastitis. Because milk stasis is often the initiating factor in mastitis, the most important management step is frequent and effective milk removal. So mothers should be encouraged to breastfeed more frequently, starting on the affected breast. Massaging the breast during the feed with an edible oil or a non-toxic lubricant on fingers is also effective. Therapeutic breast massage is huge for these moms. It provides immediate significant pain reduction for engorgement, plug ducts, and mastitis. So the principles of this therapeutic breast massage include focused, gentle massage towards the axillae, and then alternating gentle massage and hand expression. The massage is continually adjusted to the patient's comfort level. So when I teach this, I like to teach moms how to do this correctly so that they can do it when they are in the shower, and they can get a little bit of soap on their hands and do that gentle massage, and that just kind of gets that milk flowing. So emptying the breast with therapeutic breast massage decreases the duration of mastitis and improves treatment outcomes. And analgesics such as ibuprofen may help with the letdown reflex and should be encouraged. It may also be effective in reducing the inflammatory symptoms. So probiotic strains of lactobacilli isolated from human milk may be a new strategy to treat and prevent mastitis, but clinical evidence is currently lacking on that. So if symptoms of mastitis persist longer than 24 hours, an anti-staphylococcal antibiotic such as dicloxacillin or flucloxacillin should be commenced. If the patient does not respond to antibiotic treatment within 48 hours, admitting her to the hospital for intravenous antibiotics and getting a culture of her milk to rule out methicillin-resistant Staphylococcus aureus is recommended. Complications such as an abscess and/or a yeast infection can occur after the onset of mastitis. So it's important to teach our patients this as well, that they really need to watch out for an abscess formation and/or a yeast infection. Okay. So let's see. Computer froze. I'll need to respond here in a second. So mothers should be helped to improve infants' attachment to the breast, so feed should not be restricted. Let's see if I can get this to work again. Okay. Feed should not be restricted. Mothers should be taught to hand express when the breasts are too full for the infant to attach or the infant does not relieve breast fullness. A breast pump may also be used. Mothers should be taught to check their breasts for lumps, pain, or redness, any hard places that need to be massaged out. If she notices any signs of milk stasis, she needs to rest. Increase the frequency of breastfeeding. Apply heat to the breast prior to feedings and massage any lumpy areas. Mothers should contact their healthcare provider if symptoms are not improving within 24 hours. And then skilled help is needed for mothers with damaged nipples. So getting the mother the help from a lactation consultant may be necessary. Healthcare providers should encourage mothers, breastfeeding mothers to obtain adequate rest, since often fatigue is a precursor to mastitis. So it's important for, oh, there we go. My computer froze a little bit. Okay. 1 second, get this working again. Oh, no. It's freezing up on me. Okay, so some prevention measures. It's important for hospital staff, new mothers and their families to practice good hygiene, good hand hygiene, because Staphylococcus aureus is a common commensal organism often present in hospitals and communities as well. Okay, so I'm gonna have to do this way since it's not cooperating. Some questions that I'm gonna ask the group would be, would we have the patient continue breastfeeding or stop? Is the milk still good if a patient has mastitis? How does therapeutic breast massage help? And when the breast is too painful to touch and the mother cannot get past the pain of latching her baby to her breast, what are some ways she can facilitate milk removal? So to answer number one, the baby breastfeeding works better at facilitating milk removal than hand expression or pumping. So of course we wouldn't want her to stop breastfeeding. We would want her to continue. Also, if she stops breastfeeding, she would put her infant at risk for illness and may have a greater risk for abscess development. Sudden cessation of breastfeeding leads to a greater risk of abscess development than continuing to feed. To answer the question number 2, is the milk still good if a patient has mastitis? And mastitis does not affect the milk. It actually is the tissue that's infected, not the milk. So we would, of course, have her keep breastfeeding. Number 3, therapeutic breast massage works by promoting fluid drainage towards the axillary lymph nodes. And then by performing therapeutic breast massage and hand expression, fluid mobilization occurs. Milk stasis is often the initiating factor in mastitis. And then number 4, when the breast is too painful to touch and the mom can't get the baby latched on, mastitis is very painful. So the mother can begin by taking Motrin to help with the pain and swelling and applying heat. And then after the pain subsides, she should attempt to breastfeed. Therapeutic breast massage and hand expression to facilitate drainage would be the next step. And then after feeding or after she breastfeeds or after she expressed milk, cold packs can be applied to the breast to reduce pain and edema. Okay, so applying what we've learned here in the case study that we went over, the patient in the case study will need to be prescribed antibiotics to get better since the onset of her symptoms have been longer than 24 hours. The onset of mastitis probably occurred from the infant having latching issues early on with breastfeeding, and there was damage to the nipple, along with symptoms of engorgement. Classic symptoms of mastitis are fever, chills, and flu-like symptoms. And then if recognized early, mastitis can be managed by increasing milk drainage from the breast, applying heat before a feeding, and then cold packs after a feed. So the overview on this and linking of contact, mastitis is inflammation of the mammary gland in the breast, typically due to bacterial infection via a damaged nipple. It's often caused by damaged nipples during lactation. Prevention is breastfeeding more frequently and breast massage and hand expression during breast fullness and engorgement. And then nurses need to know how to teach moms prevention techniques such as therapeutic breast massage and hand expression. Okay, and then understanding our goals, women's services nurses will understand that informing mothers about ways to prevent mastitis assists the mother in meeting her breastfeeding goals, fulfills Texas 10 Step 3 and a requirement of baby friendly. Step 3 states inform all pregnant women about the benefits and management of breastfeeding, and then also it prevents the mother from having further complications from mastitis, including potentially being separated from her infant, hospitalized on antibiotics, and or abscess formation. So I'm just going to go through a little bit of the technique of therapeutic breast massage and hand expression. They will learn this. On the video, but demonstration with this simulator that we have oftentimes works when I'm teaching lessons. So therapeutic breast massage is kind of just massaging around the breast toward the mother's axillae. So it works better if you have something on your hands. I tell them, lotion or soap in the shower, even lanolin ointment works. So you just want gentle, the key here is gentle massage, okay? So gentle massage toward the axillae. So, and then with hand expression, this is a technique that oftentimes nurses have to practice to get it right, so that they're able to teach their moms how to get it right. So to do that, you just push back, and if you see liquid coming out of this simulator, that's when you know that you are doing it the correct way. So you want to put your fingers, I usually tell moms between, if you look at this as a clock, the areola as a clock, between times 3 and 9, and she would do it underneath, and you want to push back and then just squeeze. And it takes a little bit to get the milk or the fluid flowing, but if it's done correctly, you'll start seeing the fluid come out, and oftentimes a spray happen, okay? And it takes a little bit to get this. So I do have nurses practice with this because it is a technique that you kind of do have to practice with to be able to teach your moms how to do it. And I oftentimes give moms a video as well to watch so that it teaches her where hand placement and things like that go. Anyway, I hope you enjoyed this and have a great day.